You're welcome to yet another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Authority, NHIA, to keep you abreast of its strides as it moves Nigeria towards attaining universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. For quite some time now, we have been focusing on the National Health Insurance Authority Act signed into law on the 19th of May 2022. We have looked at some of the efforts of the new agency to bring stakeholders as well as its own staff on board the new thinking. As part of our efforts to deepen understanding of the new act, we engaged Blessing Nienge, the General Manager, Legal Services, National Health Insurance Authority, for more insight into the new act and how it will help the country in the attainment of universal health coverage. Please stay tuned as we bring you details from our interview on the program this evening. Keep watching.
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIA. First on the program is a highlight of events around the NHIA. In the news, Committee of CMDs pays courtesy visits to NHIA. Also on the lineup, stakeholders share their thoughts on NHIA Medicine Supply Initiative.
The management of the NHIA has received a delegation from the Committee of Chief Medical Directors of Federal and Tertiary Health Institutions led by Professor Awal Abubakar. While speaking, Professor Abubakar congratulated the management on the signing of its new act, while commending the leadership for stability in the NHIA. He also seized the moment to seek redressal on some challenges around the health insurance operations with providers.
We felt it necessary to interface with your authority to actually intimate you on some of the challenges that we face. The very important one is the fee for service. In most hospitals, even though reconciliation was done for 2016 to 2019, most of the HMOs are yet to pay. And not to talk of 2020 till date.
While responding, Director General NHIA, Professor Nasir Sambo, appreciated them for stability and modesty in the health sector. He said collaboration and regular consultation will help the implementation of the mandates of the NHIA.
There is no doubt about the fact that for NHIA to be able to meet its mandates, there must be a very good working collaboration between the authority and the hospitals, because hospitals represent the outlet upon which our image is assessed.
He also added that health insurance is also the responsibility of every stakeholder, urging them to consider some factors affecting the processes. The DG then promised to look into the challenges and issues presented to him. Some stakeholders have described the Medicine Supply Initiative of the National Health Insurance Authority as a laudable one that will help strengthen the system. They spoke during interviews at a one-day sensitization program for healthcare facilities in Abuja. The stakeholders promised to make the initiative work in spite of challenges that may confront implementation.
It's very excellent, very excellent. We have so many things under this roof. The speed at which we are going, every Nigerian will be very happy. This is the best thing ever happened to us in recent time, to have this health delivery system down to the common man's level, what we call as universal health coverage. Now the drugs will be available. When we collect all the groups of 86 million Nigerians and then we get the funding, everybody along the streets will be covered. And the sky is the limit for the health industry.
All of us, we know
the burdens are on our head. So it's like a cobweb. There is nowhere you touch it that will not shake the system or shake the table. So all the stakeholders should be ready to interact much more often than we were doing before. But the truth of the fact that the task ahead of us that we are facing right now is a task of solution, solution, solution. And therefore, it is our hope that we're going to get the buy-in of other stakeholders, especially the uptakers. Who are these uptakers? The enrollees. The patients, they are the center for our practice. And if they are the center of our practice, every stakeholder must do something to please them.
The NHIA Medicine Supply Initiative is an avenue where medicine consumed by enrollees while accessing healthcare will be branded and provided by NHIA to healthcare facilities. This will help curb the out-of-stock syndrome bedeviling enrollees when they visit healthcare facilities.
Welcome back. With the recent assent of the National Health Insurance Authority Act, among other things, the law has strategically expanded the operations of the authority. In this episode of Easy Access to Healthcare for All, we'll bring you an interview where we discuss the NHIA Act 2022, reasons for the amendment of the NHIS Act 2004, its highlights, and the objectives of the new law. This is contained in our next segment. Keep watching.
The NHIS, now NHIA, was created in 2005 as a tripartite public-private arrangement among three main stakeholder operators: the NHIS, health maintenance organizations, and healthcare providers. Its aim is to ensure that every Nigerian has equal access to good quality healthcare services at an affordable cost. So far, less than 10% of Nigerians are said to be covered due to circumstances beyond the control of the NHIA. Blessing Nienge, GM, Liga, NHIA, takes us through the journey from NHIS to NHIA. She gives a background and comparison of both laws. She tells us why the law had to be amended.
So many reasons, but the key is the one that the desire to make health insurance mandatory. That was the main reason. Why? Because we have done tours around the world as an organization, and we have seen that when you make it optional, the desired success will not be recorded. And even in our case, from 1999 to date, to the 19th of May 2022, where the president signed the law, we did not have it easy at all.
With the assent to the new NHIA Act, one will expect a different advance towards the health insurance ecosystem. Blessing Nienge speaks on the objective of the new law.
19th May remains memorable in the NHIA, and we are grateful to the president for doing this. And the main objects are three. That is for the NHIA to promote health insurance, to regulate health insurance, and integrate all the health insurance schemes that we have in Nigeria. Of course, you know what it means to promote something. We will have to go into education and sensitization more. We have to regulate all the schemes that are operating, health insurance schemes that are operating, be it in the states, wherever. We have to regulate what they are doing to be sure that the standard, the basic standard for operating health insurance in Nigeria is maintained.
A comparison of both laws gives an insight of what is ahead for the NHIA.
The objects are now different. In the old act, the mandate was just to ensure universal health coverage, but there were no clear-cut objects like what we have today. So in that area too, there's a difference. The second and very importantly, is the fact that health insurance now in Nigeria is mandatory for everyone. Every Nigerian and legal residents within Nigeria. So that means everyone is expected to come on the ship of the NHIA, that is come on board, be registered, so that you will get health insurance, you will get qualitative health care, as it were. And the other area that is new completely is that of the establishment of a vulnerable group fund. The vulnerable group fund is expected to take care of vulnerables in Nigeria.
Other significant aspects of the new act include the change of name from National Health Insurance Scheme (NHIS) to National Health Insurance Authority (NHIA). A constitution of the NHIA board, unlike the old one that had presence of members from HMOs, the new law takes out HMOs from the board and includes members from the armed forces and civil societies who are health insurance inclined. The new act introduces third-party administrations, a role played by health maintenance organizations in the old law. What then is the fate of the health maintenance organizations in the new scheme of things?
Before now, there were key stakeholders, there were managers of health, there were also financial managers, and there were risk bearers. But now it has shifted in the sense that the law gives us the option to use or not to use, and if we are to use them, we will have to come round the table again and agree on areas of engagement. So it is no longer automatic, but areas of engagement. For example, the law says they can come as third-party administrators, and in that case, they may just be doing administrative work.
The new NHIA Act stresses the need for integration with states. How does the authority plan to achieve that?
When you talk of integration, like I mentioned earlier, you are looking at collaboration. That is what you are looking at. How do we sit together to ensure that everybody comes into this the health insurance ecosystem? So already we had a program called Health Insurance Under One Roof, where we were coming together with all our key stakeholders, and looking at the states and what is specifically stated in the act, it will just strengthen our collaboration, and we'll work together.
A major highlight of the new NHIA is making health insurance mandatory. How does the organization ensure compliance with this provision by citizens?
What we intend to do is to reach out, do high-level advocacy to top government functionaries, and ensure that there's a circular to the effect that every employee of government should participate in the health insurance as it were. And then if you come to the same with organized private sector, where you look at companies, that is limited liability companies, all over the federation, you must register your employees in accordance with the new act. So we intend to reach out to all the companies in the organized private sector, the formal sector, like I said, and when it comes to informal, which is wider, we are looking at, first of all, the vulnerable group fund that I mentioned earlier, and what the government will do to ensure that vulnerables are catered for. And then those that are outside of it, we will still find a way of, through other programs, of bringing them on board.
With the new NHIA Act, the authority is working round the clock to get the ball rolling for the attainment of universal health coverage in Nigeria. And it is towards this end that the authority recently organized a retreat for its top management staff staff of both zonal and state offices, development partners, among others, in order to sensitize everyone about the new NHIA and their various roles in making it effective.
Owners of healthcare facilities are not only stakeholders, but partners in the health insurance business. They interface directly with enrollees on a regular basis, and enrollees' satisfaction to an extent determine the success in the Health Insurance Authority. Today on our Stakeholders segment, we bring you an interview with Dr. Dayo Awonuga, Medical Director, Crystal Hospital, Kaduna, a stakeholder under the NHIA. The facility offers both primary and secondary care to enrollees. Dr. Dayo gives an assessment of healthcare delivery system in Nigeria.
The healthcare service itself, I would say, is quite poor, but with the coming in of the National Insurance Scheme, it has improved a bit. Now, like I will tell you now, if not the NHIS, I wouldn't have this kind of hospital because the economy is poor, so many people can't pay out of pocket. So in the coming of the NHIS, to make it easier for us, to get funds, and that's just it. But generally, the healthcare service there is quite poor, and that's why you see our leaders traveling out of the country to get healthcare service abroad, But like I said, the coming of the NHIS has made it a bit better.
Dr. Dayo stressed how the impact of NHIA has helped Nigerians access quality health care at an affordable cost.
Yes, it has. So we were saying before the NHIS, I could start with the federal civil servants, and they will attest to the fact that it has made a difference. You go to the hospital, you don't have to pay, and you get your services done. You do your surgeries, your specialist condition, and so on and so forth. So it definitely has an impact on the healthcare.
He speaks more on NHIA benefit package offered to enrollees on the health insurance.
The payment package has been reviewed, I think, about 3 times now, and right now it is very okay. So it covers almost all the illnesses, specialist consultations, and except the I would say the high-falutin illnesses. Like kidney transplant, heart transplant. But it's definitely, for right now, they've included cancer treatment in it now, dialysis and all that. So I think it's okay. And of course, for the common illnesses we have, it's very okay. It's very okay. In fact, let me digress by saying, compared to most states have their own health insurance now. We are saying, why not just copy the National Health Insurance Scheme medical package? That was quite poor compared to the National Insurance Scheme package.
Dr. Dayo is grateful for regular payment of capitation for the enrollees in his hospital. These, he says, has helped him sustain his facility.
So you get the funds, up front, and you're able to plan on it, and after spending the ones with drugs on service, on salaries and all that, and the utilities. The remaining amount is used to buy equipment and develop like I did now, with a bigger facility and all that. So it has really helped, I must confess.
Dr. Dio speaks further on his relationship with the health maintenance organizations as it relates to referrals and payments.
The HMOs, yes. So they're about 50 HMOs now, and some are okay, some are not too okay. But we try to cope with them, manage them, so they don't pay on time, some pay on time and all that. So, but so well and good, and we keep. There's a mechanism of getting redress, through the NHIA. You can write to complain that you're not being paid and all that, And of course, the problem will be is not the capture is paid on time. That's okay. It's always about the fee for service. That's always the problem, The bills build up and they don't pay on time. The code, getting the referral codes, it's not too bad. Some HMOs might delay, but all well and good. We are quite experienced about how many years now, so we are used to the system. We try to cope.
He says poor coverage and low awareness is a major problem in the attainment of universal health coverage.
So the first thing is the poor coverage. So like I said, 5% coverage is definitely very poor. So and the problem is that, so for now, it's always the organized sector, formal sector, or even the organized private sector that are involved now. So the other people, informal, the mechanics, the tailors, the hairdressers, and what have you. I think the problem is that I don't think they really well informed, and that's, I think, so there's not much information going out to them.
Finally, he applauds the present leadership of the NHIA and some reforms surrounding the health insurance operations.
For example, this company has done very well. In fact, so he's the one who brought up this system whereby the HMOs have to get a letter of non-indebtedness from the providers so that they get paid and all that. So he's doing very well, and of course we are saying that the price of drugs is going up very much in Nigeria now. So we want a review of the capitation amount. That's what we were asking for now. That the capitation amount should be reviewed upwards. But I know it's an ongoing process. So keep talking to each other and respect it to go on like that. But I think Zaba has done very well.
That was Dr. Dio Awunuga speaking on issues surrounding the health insurance operations. For now, let's take your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Are children covered under NHIS?
If you look at the way the NHI is structured, what we call the formal sector program, the public sector program, if a principal who is like the worker gets enrolled, this is the spouse, the children biological children under that principal, 4 of them under the age of 18 years are covered under the program until they get to the age of 18, when they can now join other programs to continue.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Join us every week as we continue to bring you updates on activities of the National Health Insurance Authority as it marches towards universal health coverage. See you next week.